New York City became an epicenter for Chinese immigration in the 1980s and 90s. For most of these first-generation immigrants, bilingual resources and services were scarce.
I remember we used to have a joke saying that we look like a disabled person. We're not able to hear, we're not able to read the language, we're not able to speak the language.
They just speak Chinese. So when they are in the hospital, they become like hopeless.
With the increasing population, medical providers started noticing cultural nuances regarding the way these new immigrants sought medical care and their aversion to hospital visitations.
The most difficult for them are how to navigate through the medical system here.
So by the time they get admitted to the hospital, they're very sick and usually they don't make it.
The first Asian services outreach efforts went into the booming Chinese-dominated textile industry in Chinatown to educate new immigrants about basic Western medical care.
Chinese people won't come to you. You have to come to them.
That's why we start this program with the health screening on the street or at the garment factory.
To help to promote, basic education to, the workers inside the factory.
However, for Asian patients who went to hospitals, many still had trouble accessing services.
One of the cardiologists was getting really frustrated that the patients would get lost and they wouldn't get to him on time. So he went into the chief medical officer and said, we really need a coordinated program.
To make their facilities accessible to the changing community, local hospitals responded by providing Asian-specific services.
We started to add staff and looked at bilingual services through the hospital that particularly catered to the Asian community.
We recruited a lot of Chinese-speaking volunteers to be the patient navigator. We have Chinese interpreters to assist with patient with any of their language need while they need to see a doctor.
On-site interpreter, they can look at the patient face.
你雖然有電話翻譯，但係嗰啲耳仔唔好嘅，咁你咪等於冇用係嘛？
More Chinese doctors come in, get trained, including myself.
When they walk in the door, they see the face of Asian patient, they feel much more safe.
There was a, wow, thank you so much. Thank God you're a Chinese doctor.
The introduction of these programs and services was so effective, the number of Asian patients grew exponentially.
From 1991 to 1995, increased from 0 Chinese patients to 40% Chinese patients at that one site.
I see dramatic growing. Right now, about 60 to 70% of my patients are Chinese.
Over the years, these services have evolved. Asian services now extend beyond the hospitals into the community to provide an efficient and effective network for medical care.
I call it a concierge program.
Do like a one dragon service to be able to help the patient to schedule the appointment, to arrange the interpreters on the spot.
We actually follow these patients throughout the hospitalization, in contact with their primary care doctor specialist, so they have a proper handoff information.
When those patients are directed back to their primary care providers for continuous care so that there's good communication between the inpatient and the outpatient.
We also communicate with the rehab centers and nursing homes. Our goal is to provide a comprehensive care before the hospitalization, during the hospitalization, and after discharge.
Asian services staff members remain in contact with patients after they are discharged.
How am I going to make sure that if I see a patient in the emergency department, that they're going to go fill those prescriptions? And that's where my team comes in. They connect with the patient at home, they make sure the prescriptions are being taken.
The most important thing is not only the treatment in the hospital, but also the follow-up. So this is also the effort we're trying to do to avoid the readmission.
Beyond language services and staffing, accommodations are made in consideration of specific cultural traits.
They can have Chinese menu, they can choose kanji, they can choose noodles. For Chinese New Year, we'll give patients special food and we'll give them the spring scroll.
When we try to allocate the patient's bed, number 8 will be some lucky numbers for the patient.
When we're not there, we developed a handbook. If they want to return to the bed, they need help, they come back to the bed. They could just point to that. My job is being able to know what people need before they even think about it. And for them, it would feel like a true gift.
Some hospitals have even established units dedicated to Asian inpatients.
We started a Chinese unit. On that unit, 24/7, there is always staff who speak Chinese. So these are all with the idea of understanding the Chinese patients and trying to provide for their needs.
Cultural awareness education is also conducted among hospital staff members, so the most efficient and appropriate care will be given to their Asian patients.
Workshops is very important for the clinical staff to know some of the cultural sensitivity issues.
So that we have on staff teams who are familiar linguistically, but also culturally with the patient's needs.
Like Chinese patients doesn't like to take a lot of medicine, like especially pain medicine.
Yet they were in terrific pain. But it wasn't until the Asian services team came up to me and said, Barbara, they're not going to ask for pain medication. You need to order it. It's such a small thing, but it's a big thing for the patient.
There's a stubborn stigma in the Asian community when it comes to psychological care. Integrated behavioral and psychological care provide essential care to those who would otherwise not seek it, in fear of being shunned by their community.
We have the license to provide integrated care. You go to a medical clinic, you're taken care of. If you're already in our behavioral health network, you have physical health needs, it's taken care of, the easy access. Right? There's nobody saying, oh, you're crazy. It's a way to stigmatize.
Unfortunately, often the very first time an Asian person comes to seek medical care is through the emergency room. Screening programs in the emergency room offer an effective way of catching potential health issues early on.
It starts from May to now, we probably provide over 4,000 people with triple virus screening at our emergency department. A lot of people, they just use emergency as their care. And I think that will help us in the future to prevent more severe disease like liver cancer or other complications.
Ongoing community outreach programs act to provide education about the healthcare system and diseases that are becoming more prevalent in the Asian community.
Challenge is really to teach the community in how to utilize the health system.
We want to bring out the new technology and the new methods to the community, let them know there's a new things coming up, and then if you really need help, you need to talk to the doctor.
Community education and free disease screening help to contribute to data on the Asian-American population. When it comes to getting things done, statistics and data play a critical role.
There's no money for us to doing research. Why? Because they have no data.
People decide policy depending on the data. We're doing all this disease-focused program. While we're doing that, we can collect data. This data will be beneficial to research. Based on the information, then we can change the policy.
We did a osteoporosis study on Chinese male, thanks to the CAIPA and CAMPS Community Fund. Many years ago, there's no data in an NIH data bank, and now they have it. Why? Because we did it. When you have this kind of data, then you can prove it. Chinese population is not healthy as you think.
Serving the community is a process of endless giving and requires a passion much deeper than simply staying faithful to the job description. And the Asian Services team have done just that.
对病人是比较有爱心，下班时间不在他们工作的时间要求他们都会尽量满足我们。
Patient came back to my office one day. She said, I would like to pray for you for my entire life. It's a very easy job for me. It's just like a 1, 2, 3 things. But for the patients, we really provided a great help.
佢哋真係好關懷病人，而且即係對病人咧係非常非常之體貼嘅。咁啊，我喺呢度即係衷心感謝佢哋。
Ultimately, it's that one simple wish that makes it all possible.
Being involved with patients and making a difference, because we take real satisfaction in trying to meet people with their needs, ameliorate those needs, and help them lead the productive lives they want to live.
When you see they come very sick and they leave, they can walk out of the hospital, you already feel accomplished. Nothing is more important than the feeling of saving or helping a person. I think that's the great sense.
When you get older, you still come back to your own community because you will feel like that's still your roots. You don't help your own community, other people are not going to.
And so the reason I do what I do is because I want to give this gift back to the Chinese patients and to our community. It's very important to me.